Tell me your thought process and how did you think about the insurance? What were you trying to protect against?
Yes. So I hate looking at health insurance because there's so many plans it can make your head spin. And really what you're doing is you're comparing kind of the premiums. How much am I paying for this plan? And most people are looking for the best benefits. They're like, all right, well, am I covered if I do this? What happens if I go to a doctor visit, out of network, in network, specialist, hospital stay? And I started going down the weeds with all of that too. And it was driving me nuts. And ultimately, I said, wait, all right, there's a special thing in all of these policies that I think matters the most to me today. And it's called an out of pocket maximum. So for all of these plans, even if you get the worst plan available, they have a number that says, all right, whatever else happens, this is your maximum amount you're going to pay for your medical care this year, regardless of what goes on. And so I stopped looking at all the nitty gritty and said, all right, let's look at this maximum out of pocket and let's look at the premium and see how those play off each other if I get a really bad plan or a really good plan. Because I knew we were going to hit the maximum. We had a scheduled C section, many days in the hospital. Like those things are not inexpensive because I accidentally got a bill for one for the first baby that I wasn't supposed to pay. And that was I think a $40,000 bill. So I'm like, that expense is out there regardless of what happens to us the rest of the year.